Giving birth is intense,
Yeah,
which
you
is
put your
why
life on the line.
it is why maternal health should not be a political football. Because what our bodies do, what we are capable of doing is amazing. But the fact that there isn't research done on maternal health, there's a limited amount of information we get about our health. We aren't encouraged to ask questions. We aren't encouraged to talk amongst each other. And I just want us to vow today, regardless of our generation, that we don't pass that down to the next generation. That we owe them the knowledge, the wisdom.
Just we want to know.
Yeah.
I mean, everyone wants to know, and they don't want to know if they don't know.
Yeah, that's right.
And so it's just like knowledge is power, and it's like when you go to school, you would never know the things that you learn unless you're taught those. You weren't asked to learn about so many subjects, but you learn about them. And I feel the same way about us and our health and passing on that knowledge, and I think it's just so important.
Hello everyone, welcome to our Mother's Health podcast. Have you ever wondered why, despite advancement in medicine and science and research, many women still say, I don't know, nobody told me? Recently, I've been listening to a conversation between Serena Williams and Michelle Obama. And what struck me wasn't their fame. Of course, as we know, these are incredibly accomplished women, incredibly global icons. And I was watching that podcast. I'm going to put the link to the podcast somewhere in the description box. And it struck me when they simply said they didn't know much about fertility. They didn't know much about their bodies, about pregnancy. And they simply said nobody told them about some of the things that they experienced in their life. And these are women that I believe have great access to the best medical facilities in the world. So this is quite intriguing episode and discussion, because one would have imagined that with all the access to education and facilities, that they would have known about fertility. And what does this say to us? And this made me stop to think that if these incredibly successful women did not know much about fertility, how much more women in Nigeria, how much more women in India, how much more women in sub-Saharan Africa, how much more women all over the world, if this were not given the necessary information that they needed about fertility and childbirth, then perhaps we don't stand a chance. But that can be changed. So welcome to the podcast, everyone. My name is Dr. Viviane Chinwah. On today's topic, we're looking at knowledge is power and lessons learned from Serena Williams' conversation with Michelle Obama. In this first segment, I will be discussing why women have little to no knowledge about fertility. One thing that really stayed with me during that conversation was a statement made by Michelle Obama. And she said that women rarely get the right information about fertility, about the options available to them. And having information was based on whether you have the right hospital or doctors and you have the right support needed for you to get that information. And this shouldn't be the case. This is not how healthcare should work, according to what she stated in that podcast. And I quite agree with her, because healthcare shouldn't work like that. We should have access to information, it shouldn't depend on your location, where you are, the kind of hospital you use, and it shouldn't depend on if you are in Nigeria or you're in the UK or you are in the States. Information should be readily available to women in different spaces. And these are some of the things that we must try to correct for the future generation. As an advocate for maternal health care, I believe that information should be made available to every woman, timely, structured information in different spaces. So why don't we talk about women's health more? Serena Williams made a very beautiful statement there where she says women need more open, honest conversations, and that in many cultures, there are often whispers of discussions around women's health, whispers around infertility, whispers around miscarriage, also whispers around birth traumas, because even there are circumstances where I've witnessed or I've seen women have children and they become disabled completely in their life. So these pictures or the discussions are not very open conversation. Rather, there is a picture that paints of a perfect picture of a mother and child, and people do not really share their real experience and what they really truly go through during their birthing process. So these are some of the things that we ought to change, and I agree completely that this conversation should become open, because silence doesn't protect women, but knowledge does. And when we share our knowledge with each other, like we've done on the podcast, when we share our knowledge of our birthing experience, our shared knowledge on birth traumas, we can learn from each other, and this can really help the future generation, because what we want to prevent is that we do not have this for the next generation. The culture of silence must be changed, so that people could have more knowledge about their bodies, about fertilities, and this is key to improving maternal health globally. Now, one of the most moving parts of that discussion is Serena Williams talking about the life-threatening condition she faced during childbirth. And of course, this is not a regular thing people will discuss. Women want to appear strong. Many people don't discuss the traumas that they face during childbirth. But this was really moving part of discussion. And she said something very remarkable. She said that because she had access to the right skilled care workers that listened to her complaints, and that was what saved her life. So in the last episode, when I talked about the Nottingham scandal, one of the major issues with the Nottingham hospital was the lack of listening. There was no clear communication, and issues were not escalated quickly, and that led to the death of so many mothers and babies in that hospital. And I quite agree with her. Listening is not just an extra option. Listening is a clinical tool where we can listen to women and not gaslight women. Then we can take necessary precautions and actions to save their life. And she said that very clearly in the video, that it was because the medical practitioner listened to her, they saved her life. So it's not an option. Not listening is not an option. I would like to stress clearly and categorically that maternal health is not a political issue. It's everyone's issue. I know that sometimes health is being used as a political tool, but this shouldn't be, because maternal health is a very sensitive issue and that requires attention. Now, maternal health is about mothers, it's about babies, it's about the community, it's everyone's issue. We must all actively engage in communication about maternal health. We must actively engage in conversation around women's health. We must encourage our wives, encourage our daughters, encourage our husbands, and everyone within our community to educate themselves on maternal health. I would also like to emphasize that information can be made available in social groups such as churches. Information can be made available in schools. Information can be made available on social media. Now we have to take a bit of precaution when we come to social media, but we must have these conversations. We must speak confidently. People must share their story. And this is what our Mother's Health podcast is about. It's about sharing our stories. It's about sharing concerns we have all over the world. And so with that being said, if you're here on this podcast, if you watched this video and you would like to come and share your experiences with us, how you overcome your challenges, please get in touch with me. I'll put my email on the screen, and you can also DM me, and I can host you on the show to come and share your experience, because this is what it's about. It's about sharing our experiences with the world so that other people can learn and can listen to our stories and our experiences and learn from those experiences. Gone are those days when we begin to whisper about these things. Gone are those days when we begin to feel insecure about sharing our own birth experiences, because you might just be saving a life when you share your experiences. So I'll be looking forward to having you all on the show. So please contact me if you'd like to share your experience. Maternal care is not just about surviving birth. It's about having the right information during childbirth and afterwards. We would like to have more information about our bodies, about fertility, about the next step, about how to care for ourselves, and open conversations are very important. Serena Williams stressed that women are not encouraged enough to share their stories. Women are not encouraged, and that needs to change for the next generation. And that's why we have this podcast. So what have we learned from this episode or from this conversation? I've learned 5 important lessons from this conversation, and I wrote them down, so I'm going to read them. So first, ask questions. So every woman listening, first, ask questions. Secondly, trust your instinct. Do not let anyone gaslight you. So if you're having that pain, you are having that discomfort, trust your instinct. Ask questions first and trust your instinct. Third, find a healthcare professional that can listen. This third question, or this third lesson, finding a professional who listen, it makes me to reflect on developing countries or sub-Saharan Africa or South Asian countries where they're experiencing high mortality rates. Who are the professionals available? When you come to sophisticated or advanced countries, you have options, and if you have the resources, you have options. But there are situations whereby these women have no options and they can only rely on the traditional doctor available or the community nurse that acts, the community staff or health worker that acts like a nurse or acts like a doctor. So that's what they have available to them. But having said that, it's important that if you can and you have the means, find a professional that listens. If you have spoken to one professional and they have gaslighted you or dismissed you, you can go to the next person. Have double opinions on your health. For you living in the grassroots, your health is very important. And sometimes I understand that it can be tricky to get the resources that you need. But if your instinct, we are saying you should trust your instinct, then trust your instinct enough to find somebody, to find that nurse, to find that doctor that can give you a second opinion about your health. So that is very important. Fourthly, talk openly to other women. And this is very important. And this is particularly because in many developing countries, they don't have access to the best health professionals and they don't have skilled birth attendants readily available. And so it's important that you're talking to other women, because if you've spoken to other women and they've had similar experiences like you've had, you might be able to tell when something is serious and you can take the next step and next action towards tackling that problem. And finally, pass the knowledge to the next generation. Pass that knowledge. It's very important that we pass the knowledge to the next generation, because informed women make better decisions. In conclusion, whether you're a celebrity, whether you're the shopkeeper, the farmer, the woman on the corner, you're a first-time mom, you're from a minority background, black and brown women, wherever you're coming from, women from all walks of life, wherever you find yourself, you deserve information and you deserve respect. Let's stop treating conversation around women's health or conversation around maternal health or having conversation around maternal health only when things go wrong. When there's a scandal, when there's a problem, then we bring up the conversation. Conversation should be normal, should be formal, should be incorporated in our care, should be incorporated in our society, in our species, because knowledge is power. And sometimes knowledge can save lives. Thank you for watching this podcast today. If you've enjoyed watching this podcast, don't forget to like, share, subscribe to this channel, and leave a comment what you think about the conversation between Serena Williams and Michelle Obama. And let me know how you're feeling. Drop a comment in the chat box. And this is Viviane Chinwah, and this is our Mother's Health Podcast. Thank you for watching, everyone. Bye-bye.